Hello, everyone. Welcome to the Modern Day Wife, the podcast. This is Megan Fialkoff, and I'm co-founder of Modern Day Wife. And I'm so excited because we have a very special guest today who was part of our Chicago event, our premiere event in Chicago at the Fairmont on March 6th, which is,
Yeah,
what is that? Over
I
almost
know
a
6 weeks
month ago.
ago. Yeah,
And she's going to talk about a really important issue, something that affects a lot of women and men today. And I'm going to introduce our guest. This is Dr. Courtney Murphy. She's a reproductive endocrinology and infertility specialist. She's based in Chicago, and we have a lot to talk about. We actually, before we jumped into fertility, we were setting up for this interview and we realized that we both have Shiba Inus.
yeah, not very commonly found. So happy to find somebody else a member of the Shiba clan.
That's right. My mom actually works for a dermatologist and she has two Shiba Inus. So
So cute. Yeah, when you spot them, you have to stop. Moment to acknowledge.
that's right. So, okay, before we get into all the questions and all the things that I'm sure a lot of people who are listening have about fertility and what's the new technology and how young should you prep and all these different things, why don't you just tell me a little bit about your background and why you chose to specialize in fertility?
Absolutely, absolutely. Yeah. First, thank you, Megan, for even having me on this podcast. It's a topic that I've, of course, passionate about and have really built my whole career around it. But really got interested in the fertility space even as a young medical student. I was observing with a fertility doctor, and I was like, wow, the conversations that you're having, the work that you do is so meaningful and has such a huge impact on people that they really continue to take with them. From there, I'm like, okay, I'm definitely going to do obstetrics and gynecology. Went into obstetrics and gynecology, knowing that that was the route to get to a fertility specialist. And as I spent my time in OBGYN, you really see women's care from it all, from labor and delivery to menopausal care, and fertility really gets a space in the middle that really became a challenging point, I think, for a lot of general OBGYNs and not knowing how to navigate those space, how to have those tender conversations around difficulty conceiving, even recurrent pregnancy loss, people that get pregnant but can't keep that pregnancy. And those conversations are so tender. And it was a privilege to be able to have those and continue to having those. And there's a space in the field for lots of surgery, lots of medical intervention, but it's really the patient care part that I really love being able to do. And I get to do it every day. And I'm thrilled to be able to do that and be here talking about it with you today.
Yeah. You know, it is amazing. I had my son in Cedar Sinai in Beverly Hills here in California.
Yeah.
And after going through the experience of having a baby and when your gynecologist comes in to deliver and when the anesthesiologist comes in to deliver the, see, this is mommy brain, the
Give your
your
epidural and yeah.
epidural, thank
Yeah.
you, and the nurses and so on, I had a whole new layer of respect for these people because I was like, they're doing this every day. Like this is a different world in this.
Yeah. I really do feel like it's a little bit of a calling because you have to love it, right? If you don't love it, you'll get burned out. I think that's for goes to say for everything, right? You need to believe and love what you do. And OBGYNs are badass. They do really, really hard work. And I get to say that because I've stepped away from it, not doing the labor and delivery stuff anymore, really focusing on a really niche area of women's care. But the work they do is amazing, really, really amazing. They're there for emergencies, they act fast, and it was a privilege to be part of that for 4 years of my training, and I have so much respect for it.
Well, I think also the thing that I realize is how competent they are. They're so competent, and I'm bringing this up in regards to you because you're saying how you get to do work with your patients every day, and it really is a job. I don't think people realize what doctors do. Like you are diving into people's lives and becoming this person for them that they really depend upon. And I can't even describe exactly what I'm trying to say, but it's significant.
Yeah, but I think you're hitting on a point that's really important, especially right now where people communicate through so many different modalities, right? And I'm talking about non-healthcare communication. So through TikTok, Instagram, social media, ChatGPT, and AI platforms that people are inputting their own information to and looking for answers. And I think those resources are there, and I think we need to acknowledge it and use them for what they're good for. But at the end of the day, we've spent our career doing this training. We are constantly updating ourselves with evidence-based information to make sure that we're taking it all in and treating the whole patient, right? It's diving into their medical history, but it's understanding as an individual or a couple, what are their goals, right? Do they want one kid? Do they want two kids? Maybe they don't know yet. And it's really completing that whole picture.
Okay. Fascinating. Yeah, you have to be able to think with with all the information you're given, which a
Yeah.
computer cannot do. I'm sorry.
Yeah, and they don't do it well for certain different demographics too, right? Like we don't only deal with cis heterosexual couples, right? I help trans on all different sorts of walks of life build their family, and those computational models don't really exist yet in an AI space. I've tried to use it before helping building like educational platforms and stuff, and it just really doesn't help kind of figure out the parts of ovaries, eggs, sperm when it comes to maybe gender non-conforming individuals. So it's an interesting space, but we do so much more, I think, than people realize.
Totally. Well, okay, so let's bring it back to the beginning then. So
Yeah.
let's say you're a girl, you're in your late 20s, you're not married, you maybe want to get married, you haven't found the right person, you're enjoying your career and so on. So at what point, I guess if you're married or not married, at what point do you think that a person needs to start thinking about egg freezing or fertility? Like just walk us through the beginning part of this.
Yeah, for sure. I think it's so multifactorial because, like a lot of things in life, it's right place, time, finances, all that sorts of stuff, right? So, late 20s is a very, very good time to start considering it. If you're not in a committed relationship, right? Married, not, I think commitment looks very differently for a lot of people now. So, it's whatever they are looking for. And if they're not with an individual, who they're looking to build their family in the next 3 to 5 years, it's reasonable to consider, right? So late 20s, early 30s is kind of the sweet spot. Now, other things can make sense too, right? Sometimes people are part of an organization, their company offers it, and they're like, I don't know that I'm going to be with this company for the next 5 years. So let me take advantage of this benefit now. So, knowing what state you're in, California just became an insurance mandated state. Illinois is an insurance mandated state. So, certain fertility benefits are covered. Does that mean egg freezing is covered? Not necessarily. It's often a big loophole in a lot of fertility benefits where elective egg freezing isn't covered. But if your employer does and you know about it, take advantage of it,
Totally.
right? So late 20s, early 30s, very good time to think about it. And for everyone, what their goal family size is may look a little bit different, right? Some people know I only want one kid and that's it. And those conversations around egg freezing may look a little different in terms of goal number of eggs to have frozen. There's a big attrition from number of eggs to potential babies that can produce, and we can certainly go into the numbers. But depending on how many kids you want might determine how many eggs you want saved in the bank, and can you obtain that in one versus more than one round of egg freezing. But at least having those conversations is important.
Yeah, totally. I have a question. You used a word that I sort of know the definition of, and I know it's the name of a movie, The War of Attrition. Isn't attrition like you're constantly fighting something and it's wearing down? How are you?
So
Yeah.
wearing down is I guess, a good number. So the attrition literally means numbers going down. So you
Okay.
are losing. So what what it really does is it speaks to the inefficiency of human reproduction. That's really what it comes down to. So human reproduction is a very, very inefficient process. So even in
Oh,
people trying to conceive month to month, their chance of conceiving when all things line up are perfect are about 20%. Right. So honestly, with the work that I do, it feels like a miracle that any of us are here because of how inefficient the process of reproduction is. But we see that in real time when we do egg freezing and when we do IVF, because about 10 eggs will get us to maybe 2 to 3 embryos at the end of the day. And one genetically normal embryo has a 65% chance of live birth. So if I start someone with 10 eggs frozen, they may only have 9 that survive thawing and 7 fertilize and 4 make it to an embryo and a handful of those are genetically normal. So that's the attrition part that can be really hard to
right.
predict because we have these averages, but people fall on averages on one side or another of averages all the time, right?
Yeah.
So there's really handy calculators though. So individuals can go online and look up the Brigham Women's Health calculator tool. It's a free calculator. It's available to anyone where they can pop age and how many eggs they have frozen and their probability of having 1, 2, and 3 live births. So it's a really nice counseling tool that I use every single day.
Wow. Okay. It's amazing. There's so I
A
only
lot.
know from being a bystander of so many of my friends going through this
Yeah.
process. Like one of them who's in her early 40s who did egg freezing. Another who couldn't maintain having the baby from her own IVF. They adopted a baby, and then 6 weeks later, after adopting a baby, the embryo of someone else that donated their embryo, is that the right
Yeah.
word? Embryo to
Yeah.
them,
Mm-hmm.
she then was told
Got
she was
pregnant.
pregnant and had
Awesome.
that baby. And so they're
Awesome.
like less than 1 year apart. So I've seen these different things. So maybe
Yeah.
tell us a little bit about um, the different styles
Sure.
of or different services that you do.
Absolutely. So this is just speaking on, let's say, like heterosexual cis couples. So the way I think about fertility treatment is kind of like a ladder. Okay. So starting at the bottom of that ladder, you have timed intercourse where you're tracking ovulation, you're making sure there's sperm exposure at the right time. In patients with recurrent losses, there's some things that you can add into that, like progesterone support. So this is like kind of at the bottom of the step, just monitoring, finding out simple medical ways to optimize. The next step up is what's called ovulation induction and IUI. Every month, assuming a woman has regular menstrual cycles, she's releasing one egg at a time. And when conception isn't happening after they've been trying for a certain number of months, depending on how old they are, we say, okay, do we give you a medication that helps you release more than one egg? Right? So you're releasing maybe two eggs at a time to increase your chance of egg and sperm meeting. So that's called the ovulation induction part, where you can use a simple oral pill medication like letrozole or Clomid. And then the IUI
Question. You
component,
said
yeah,
IYI, that was some abbreviation you used. What was that?
yeah. So IUI is the intrauterine
Okay.
insemination part of that.
Okay.
So after you get them to ovulate maybe more than one egg, when that egg is being released or ovulating, you do the IUI, so intrauterine insemination. So you take partner sperm, or if this is for a single female or females in a same-sex relationship, they're using donor sperm. You take that sperm and you put it directly into the uterine cavity with a small catheter. So you deposit it closest to the egg being released, and
Okay.
then 2 weeks later, you do a pregnancy test. So that's kind of like middle of the rung treatment. And then moving up to the top of the ladder is IVF. And IVF can take many different shapes and forms when it comes to gamete sources. So, where's your sperm coming from? Where's your egg coming from? But the shorts version of it is you do 2 weeks roughly of injectable medication for your ovaries to grow the eggs. You undergo a surgical procedure where the eggs are retrieved or you're asleep under anesthesia. It's done through a
Wow.
vaginal approach, so no incisions on the abdomen at all. The eggs are retrieved and they're looked at in the lab, and sperm and egg get mixed in the lab. It takes about 5 days to grow out to embryos. And by the time you reach embryos, you have the choice of biopsying them for genetic information. Is this embryo chromosomally normal? If you want to know, is it an XX for a male or an XY, sorry, XX for female or
Oh,
XY for male? So some people choose to do IVF for family balancing and sex balancing of their children.
wow.
And sometimes people carry conditions that can be passed on to children and they want to biopsy and test embryos to
Sure.
make sure they're unaffected. Or sometimes I have couples that come to me and say they're 35 and they want 3 kids, but they know by the time they come back for baby number 3, they're going to be 38, 39, and our chance of having genetically normal children at that age is much lower. So they'd rather do IVF with their eggs now at their best genetic quality and then test them so they have them to use for future children.
Wow.
Anyway, IVF can be done with your own eggs, with donor eggs, your partner sperm, donor sperm, or then even the case of your friend who did donor embryo, right? So maybe we can't use their own eggs for a variety of reasons. Maybe their age is a factor. Maybe they've have early ovarian failure, or they've undergone treatment for cancer in the past and have had treatment that rendered their ovaries not usable for not having enough eggs left, so ovarian insufficiency. So lots of different reasons that people may choose to use donor gametes, whether it be egg, sperm, or embryo.
Okay. Sorry. I like to find out the words. What is a gamete? I don't know
Gamete. Yeah. So
that.
essentially just like reproductive tissue. So egg versus sperm.
Okay.
So gamete is like the non-binary term, right? We've got egg for female and then sperm for male.
Okay. Now, quick question. These are really ridiculous questions, but
Not at all.
how do you know where the egg is?
So we don't actually see it. So this is the really cool part. So when we do monitoring throughout IVF cycles, we watch the ovaries with a transvaginal ultrasound, which is an ultrasound probe that goes in the vagina, and we can see the follicles. So the follicles look like big black spaces on ultrasound because
Okay.
fluid appears black. So they're black circles, and we can't actually see the egg. So when we do the retrieval, we can see the needle draining the follicles, but we can't see the egg. So that fluid gets sucked up in a tube, and our embryologists look at it under a microscope. They take that fluid and they have a microscope and they're looking and they physically count the number of eggs that we see. So everything done past that point is under a microscope.
Okay.
Yeah.
Um, okay. And then just another interesting thing you said, and I guess you have this advantage when you do this outside and you're implanting it. But when I was pregnant, they did a blood test. They did the test where they put, I don't know if it's they pull, I don't remember how they did it. I think maybe it was my own blood test, and they could see the DNA of
Yeah.
the baby from my blood.
Totally. So that's called non-invasive prenatal testing or cell-free DNA. That's often done between 9 to 10 weeks of gestation. So when you are pregnant. So with IVF, you can choose to biopsy the embryo and have that genetic screening done potentially beforehand. Now, that's called PGT, pre-implantation genetic testing A for aneuploidy. So looking at whole chromosome numbers. So is this embryo chromosomally normal, like you and I? Does it maybe have an extra chromosome, like trisomy 21 or Down syndrome would be the most common example? Or maybe are there not enough chromosomes? Now, the reality is that chromosomally abnormal embryos most of the time just won't result in a pregnancy. Very rarely will they result
Okay.
in a pregnancy that ends in a miscarriage, and then the least likely outcome is that it results in a live birth. But this presents an opportunity to screen. Now, well, I will say, and I think it's really important for people to understand that do IVF with genetic testing, is that you should still do all your routine pregnancy screening. So even if you screened an embryo and it was normal per the PGT result and it was put in your uterus and you're pregnant, still do the recommended screening per your OBGYN, like the non-invasive prenatal test.
Yeah.
Because while PGT is an excellent test, it's not perfect.
Yeah.
So we always do the additional screening.
Fascinating. Okay. Well, this is very interesting. So, and what are you seeing the most of right now in your practice?
Yeah, so being in Chicago, a big metro city, seeing a lot of egg freezing, right?
Okay.
We have a lot of young, career-focused women, women who want to make sure that they preserve that option for them in the future. So I'm seeing a lot of egg freezing, and I think it's so important to have those conversations about is it right for you, right? Because we know that as we age, the quality of our eggs declines. And I see so many women, you mentioned you had a friend in her 40s to egg freezing. Can we freeze eggs then? Yeah, but that attrition plays into key, right, information. So I actually prefer embryo freezing because we know what we have to work
Okay.
with. With eggs, we're like, this could give us embryos, maybe it won't, and we don't know until we go to thaw them and use them. So those discussions are important. Um, but seeing a lot of egg freezing, again, just giving women the power and that opportunity to make informed decisions and just have a bit of a, I don't like to say safety net because eggs won't always give you embryos and children in the future, but a bit of an insurance policy if you need to fall back on. But like I said, egg quality declines over time, and so does quantity, how many eggs we have. So the younger that we can do this traditionally is the better. But so seeing a lot of egg freezing and then seeing a lot of people being very intentional with their family building, meaning having conversations around genetic carrier screening, right? So we can screen to see if somebody is a carrier for a condition and if their partner carries the same autosomal recessive condition that can be passed on to children, we can screen for that beforehand,
Okay.
right? And potentially
We
test
did do
embryos.
that. We did that, and
Yeah,
I think there was like, I think I carried deafness or something, and I
that's a common one I see. Yeah.
and he carried, I feel like some version of MS. They were
Okay.
very small and none of them matched or something. So it,
Exactly. 100%. You
okay.
got it right. Yeah. So we have two copies of each gene in our body, one from mom, one from dad. Autosomal recessive conditions require both to be abnormal to
Yeah.
have the disease trait. So you're a firsthand example of people we carry conditions 60 to 70% of the time, but it doesn't matter as long as we have a normal copy of the gene like you
Yeah.
do. But we see not infrequently where couples are overlapping carriers or they carry the same condition, like cystic fibrosis is very common.
Wow.
So you can choose to do IVF and biopsy embryos to avoid passing that on. Yeah.
Totally.
My husband and I did the same thing before we started trying to build our family. I'm like, let's do genetic carrier screening. It puts you in a place of power because you have information.
Yeah.
And I think that's like the biggest take home message that I can give anyone to listening to this is that information is power. So having these conversations, getting that information for yourself is key.
Yeah. It's true. I mean, it's the same thing like at my gynecologist. At a certain point, they were like, oh, if you just do this saliva tube thing, we can, sorry, these are my non-medical
Yeah,
terms.
but that's right. There's nothing
Where-
non-medical. You got it.
Okay, where they can then measure if you have the Ashkenazi Jewish, what is it, BRCA?
That's one of the cancer oncogene related, yes, but there's lots of different genes that are higher carrier frequency in Ashkenazi Jews. Yeah.
Well, I am Ashkenazi Jew, so I think this is why they wanted me to do this.
Yes.
Uh,
Yeah.
it didn't come back, and it's interesting because I'm also half Italian, and my second cousin, it did come back. So it's
Okay.
interesting, like, and she's the Italian side. But
Yeah.
yeah, I kind of usually if they suggest some of these things, I'm like, you know what? Obviously you have to use discretion and make your own decisions, but I was like, you know what? Let's just find out once and for
Yeah.
all.
Yeah.
So,
I
uh,
think the biggest thing, and this goes for like all things, but I tell my patients this all the time. I want to make sure you're understanding every single test that I recommend and why, right? Because if I can't explain the why behind it, why should you do it? And
yeah,
there needs to be an actionable item, right? So, like, say you and your husband were both carriers for that same congenital deafness gene, right? You had the opportunity to potentially intervene and do something about it. So, if something is founded in science and is actionable, I think reasonable. But again, you need to have that discussion with your doctor about it.
yeah, fascinating. Okay, so here's another interesting question. So, is the fertility coming more from the female or the male? Like, what are you seeing
Yeah,
that
it's
in
half and
fertility?
half.
It
Yeah,
really, and
yeah.
okay, so explain the male side. I don't know anything. I don't know if it's just because they do drugs. That's the only thing I've heard about affecting their
That can
sperm.
be a factor. That can be a factor, but there's lots of other lifestyle factors. And sometimes we don't always find a definitive reason. But the most easy thing to do is a semen analysis, right? So with the semen analysis for men, there's a lot of different parameters that are evaluated. There's four big ones that we look at from a fertility perspective. But aside from drugs, you mentioned smoking can be one of the biggest negative effect on sperm.
Wow.
Oh, yeah. Tobacco, nicotine use, even for women's eggs. There's not a lot women can do to have a directly negative impact on their egg count, but smoking is one of them. So if you're listening and we're a smoker and we want to build our family in the future, I would stop that. But for men, smoking can have a significantly negative impact on sperm. The good news is that sperm is made every 72 days.
Oh, wow.
It continues to regenerate. That's the maturation process of sperm. So it's continually being made 72 days to mature. So any lifestyle modifications that are made today tends to be reflected in sperm 3 months from then. Okay, so it takes some time. So tobacco is a big one. Another huge one that I ask all of my patients to make sure that they are not taking is testosterone. I need like a big
Oh,
PSA that testosterone use will absolutely kill a sperm count. And this is so important to know because there are so many men's health clinics out there that totally get it. If men need to be on testosterone, that's one thing, but you need to ask, are they trying to build a family or start a family with their partner? Because it can deplete, and not only will it deplete, depending on how much and how long they've been on it, you may not get it back.
so why? But isn't testosterone the male hormone? Like, wouldn't you think that it creates semen? I don't understand that.
Yeah, so great question. So when men's body sees testosterone, they're like, okay, great. I don't need to make my own anymore because I'm getting it for somewhere else. Okay.
Okay.
So the testicles stop producing their own testosterone. And when that happens, the sperm production chain shuts down. So it's like an internal feedback loop, right? Because if your body's seeing testosterone from somewhere else, we're like, okay, I don't need to do it anymore. It's being taken over for me.
Is this the
But
same for women? If we take testosterone, is it the same way that you would stop making it?
no, different in a sense, but testosterone for women doesn't have that same impact on like making eggs, if you will.
Okay. Okay.
Yeah,
Interesting. Yeah, because I know a girl who took testosterone for I don't remember what it was,
sure.
but for
Sure.
something, right? And obviously
Yeah.
testosterone, I think affects sex drive. I don't know. I maybe
Yeah.
got issues taking
Yeah,
it.
yeah, yeah. It
Sure.
can. Now, again, like being on it for different times for women can have a different impact. But you bring up a good point in distinguishing men producing sperm versus women producing eggs because women are born with all the eggs that they'll ever have. So this is really fascinating. I think it's really cool. We actually have the highest when we're 20 weeks in utero. So when we're a fetus, we have the most number of eggs. We have 6 to 7 million eggs then.
Oh,
And by
wow.
the time we're born, it's down to 1 to 2 million eggs. So it really, really declines, and we never regenerate or replete that pool. So that goes back to the quantity part I was talking about earlier, is that we don't know, but there are certain markers we can use to get assessment of how many eggs we have left in the bank. And we talk about that with our egg freezers or people undergoing IVF. But for men, they're constantly regenerating sperm. So there's potential to intervene, improve overall sperm parameters. So we just talked about two things that can have a negative impact on them: tobacco, alcohol use, and then testosterone, but other lifestyle things too. So the testicles, and sorry for this word on the podcast, but we'll just use our normal anatomy terms, are held outside of the body for a reason because optimal sperm producing temperatures are 1 to 2 degrees lower than core body temps. So that's why testicles are physically held outside of the body.
That's so
It's
cute.
to optimize, right? They're trying to like do what's right.
That's so
So funny from
cute.
like evolutionarily, they didn't just like figure out how to make sperm at a warmer temperature inside the body. But anyways, here we are.
Maybe there's pleasure involved in it too. I also think there's I always thought they were outside. Sorry if this is too much. I
Nothing's
always
off
thought
the
it was
table.
outside because it provides a cushion.
Oh,
Like as
I
the
like
guy's, doing his thing, it's like a little
a
springboard.
little pillow.
Yeah. That's why I thought it was there.
You know what? I like that. I need to do a bit more of a deep dive into what the evolutionary benefit is, and maybe having a little pillow.
Yeah, I think that's what it is. I totally thought that.
That's hilarious. But yeah, from a reproduction standpoint, testicles need to be a little bit cooler to help produce sperm. So if people engage in things that overly heat the body, hot saunas, steam
Oh my
baths,
God.
using car seats for super long periods of time for extra long drives, all of those things can make the testicles at a suboptimal temperature producing sperm, right?
You
But
mean
again,
a heated seat?
heated seat.
Wow,
Yeah,
this
yeah,
is very applicable to where you are, Chicago.
exactly. So Chicago winters. But yeah, so things like that. Even like, so bikers, really tight biking shorts, right? That keep the testicles really, really close to the body can cause extra heat. So things like that are always important to discuss. But doing a semen analysis first and foremost will give you like a quick and dirty answer on how the sperm looks. And yeah.
Wow. Great. I love that. I think it's a good place to kind of wrap up the podcast because that was the best part.
Yeah, the pillow is the best part. I need to do some more deep diving into other evolutionary benefits of testicles being outside the
Yeah, you could do
body.
a whole paper on it. I better be included for the modern wife.
Absolutely. I'll be reaching out for quotes.
Yeah, exactly. So great. Well, this is super informative. I actually did not know most of this. You hear bits and pieces, and I'm sure lots of women and men who are listening to this will find this really informative. So why don't you just let everyone know how they can find you and get in touch with you?
Yeah, absolutely. So I'm a fertility doctor through Pinnacle Fertility, Illinois. But the beautiful part of Pinnacle is that we actually have networks and offices across the country. So we're in LA as well, from LA to New York. We have offices. So pinnaclefertility.com. You can certainly read about any of our providers. We really are a really nice clinic to work with. And I don't say that just because I work for them. I chose to work for them because I like the way we practice and we put our patients first above all else. We prioritize communication with them. This is one of the most intimate moments that we started with talking about on the podcast that individuals and couples go through. and we're really through this process with them.
Yeah. Okay, I love that. And sorry, last question because I'm in LA. What do you know what city it is in LA?
Oh, I'm less familiar with the LA
Okay. I'm
neighborhoods.
wondering what town it's in. I'll look it up after.
West Burbank, does that make sense?
Okay, yes, that
Is that
does. That's
okay?
where my Botox and filler dermatologist is in
I think that's where it is.
Okay.
Yeah. I need to look it up. But yeah, less familiar with the LA area, but
Okay. Well, this is
yeah,
just an easy Google search. So
exactly,
thank you
exactly.
so much for
Thank
coming
you for
on
having
and giving us
me.
this information and taking your time. And we really appreciate it. And I hope everyone who listened learned something that will help them in their lives today. So
Absolutely. It was such a pleasure. Have the conversation. Information is power. And it's just time for women to put themselves first.
thank
Okay.
you. Okay.
Thank you.
So much.